Hello, good afternoon, and namaste. Welcome to the special series on women's health presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram. In this series, we have been covering pertinent issues related to women's health and wellness. Women, as we know, do have a propensity to always find some priority over their health and ignore symptoms, as they are often hard pressed for time, as women wear so many hats and play so many roles in life. We thought, therefore, we should bring to your attention key health issues, the latest in treatments and solutions, so that women can be alert and aware and understand the need to take care of their bodies and minds. Menstruation occurs during the years between puberty and menopause. Menstrual problems are those that affect a woman's normal menstrual cycle. They could include different things like excess pain, or they could be like excessive bleeding, or lack of periods, or irregular periods, anything. They're fairly common, and women of different age groups are prone to many variations and disorders of the menstrual cycle, which is well worth discussing because there are medical and lifestyle solutions for these disorders. You don't have to put up with it and live a life of pain. Also, sometimes they may indicate more serious health issues and hence must be never ignored. So, to give you her valuable insights on this very important problem affecting women's health, I'm delighted and honored to welcome Dr. Usha Bora, who has joined us today to explain the various disorders of the menstrual cycle and give us her insights. Dr. Usha Bora is head of the department and chief consultant of Department of Obstetrics and Gynaecology at Apollo Hospitals, Ahmedabad. She has an experience of over 24 years, and during her illustrious career has completed more than 10,000 gynecological surgeries and 10,000 minimally invasive surgeries, has the credit of performing over 5,000 colposcopies for the prevention of cancer. Her areas of interest are wide and include diagnostic laparoscopy, laparoscopic ovarian cystectomy, myomectomy, vaginal hysterectomy, management of endometriosis, diagnostic hysterectomy for uterine bleeding, and so on. She completed her MS in obstetrics and gynae and then her MRCOG from UK and worked in Dublin for over 10 years. And during her time in Dublin, also specialized in high-risk pregnancy and gynecology managements, and extensively trained in some of the best hospitals of the world, like the Coombs Women's Hospital and the National Maternity Hospital. She also achieved her FRCOG degree and has received and is the recipient for innumerable awards and achievements like the Gold Medal in Active Management of Labor by the Obstetrics and Gynecological Society of Dublin, the Chikitsa Ratan Award from the International Study Circle, New Delhi, the Godrej Saki #1 award, and also to her credit has a gold medal for delivering 1,000 first-time mothers, where the normal delivery rate was over 96%, and has been a faculty at various national and international forums and has been a regular publisher of research articles in many international journals. Welcome, Dr. Bora. Thank you so much for
such a humble addressing me so humbly. So today we are going to talk about certain menstrual disorders in various age groups. Now, all of us have attended various, gynae OPD with various menstrual disorders, and I'm pretty sure that this is one of the most common cause why we attend the gynae outpatients department. Now, as Dr. Srinidhi has already told us, the problems are different in different age groups. For example, if we take adolescents, so a girl normally achieves her periods between 12 to 14 years of age. If she does not achieve her periods beyond 16 years, then it is a cause of concern and her parents should be concerned and take her to the gynecologist for further investigations. The other problems during this age group is heavy menstrual bleeding and irregular menstrual bleeding, polycystic ovarian disease, which has its own consequences, and because of this they get irregular and scanty periods. During this period they also suffer from amenorrhea, and particularly in this age group we should actually rule out unwanted pregnancies or pregnancies before we kind of proceed to do other investigations. The other problem this age group faces is dysmenorrhea, which is known as painful periods, and we will talk about its management as we conclude in this session. The second problem which girls or ladies faces from the age of 20 to 35 years, where the periods actually become more regular, but they are in the reproductive age. So there also sometimes they can present with, though the periods are regular, but they can have heavy menstrual bleeding. The periods normally last from 2 to 7 days, and the cycle length is between 28 to 40 days. This is considered as normal. So anything beyond this is considered abnormal. So what happens? And they also suffer from scanty periods and irregular periods. So these problems again can lead to anemia, which causes tiredness, dizziness, and other symptoms, unable to do the routine household activities or go to work. And scanty and oligoamenorrhea leads to difficulty in getting pregnant, or they tend to gain weight. So these are the problems. During the late 20s or early 30s, they suffer from premenstrual syndrome. This is also very annoying conditions. It happens before the onset of periods, and you don't know, okay, what exactly is causing it, but mostly it is the hormonal changes which causes premenstrual symptoms. They can be in the form of headache, irritability, mood changes, insomnia, generalized body ache, a sensation of bloating throughout the body. So basically, it is said that if you consume more salt during this premenstrual phase, this tends to be aggravated more. So one should be cautious about this. Then the third problem starts when you're around 40, 45, up to 48 years of age. Here again, because of various causes, various pathologies, the lady suffers from heavy menstrual bleeding or chronic pelvic pain, and form of pelvic inflammatory disease, endometriosis. The heavy menstrual bleeding in this age group is related to certain pathologies like endometrial polyps, uterine fibroids, adenomyosis, endometriosis, cancer, etc., etc. They then can also suffer from intermenstrual bleeding or postcoital bleeding. This should actually not be ignored because it can have serious consequences like cancer of the neck of the womb. Though it can even happen like in between, if there is a Michelmerz, which is also known that if a lady is going to ovulate, then she can also have intermenstrual bleeding. But intermenstrual bleeding and postcoital bleeding should not be taken lightly. When a woman achieves menopause, her cycles are practically gone. Menopause is something when you don't have a period for at least a year. If a lady bleeds after menopause, it's again important that she has to be investigated properly because there is a 20 to 25% chance that she might be having uterine cancer. So all these, we as ladies, we tend to ignore our health. And this is something, as ladies, we go to the doctors last. But if we go early with our problems, a lot of problems can be put at ease, and we can be more healthy and more productive at our work and at home. So this is what I wanted to say about menstrual disorders and throughout the years in women.
Thank you, Doctor. So let's look at some of the common questions that have come in. So one is, you were talking about how it's a matter of concern if a girl has not attained puberty after and has reached the age of 16 and above. What about early menarche? Now we find there's lots more of children attaining their menarche at a much younger age. So what should be the approach of the parents in that situation?
Menarche in the early age is becoming more and more common. Maybe it is because of weight gain or adulteration in the foods or something. But yes, it is something you can reassure that if the menarche has started at the age of 11, you can just tell them, look, nowadays we have seen more and more girls achieving menarche at this age. But if it is earlier, then yes, it is cause of some concern. And we need to thoroughly counsel the parents that she will require some investigations. And we can also treat this. it is a multidisciplinary team approach. We need to consult with a endocrinologist, psychotherapist, and do the necessary investigations.
Right. So, apart from the menstrual disorders itself, a lot of people also keep asking, like, what are the do's and don'ts during the menstrual cycle? Are there any do's and don'ts? I mean, are they likely to affect the cycle in any way, certain lifestyle measures or habits? So, or is it all totally out of, it's not
No,
in the
no,
birth?
no, no. There are certain do's and definitely a lot of do nots. So do's are that you have to maintain a proper menstrual cycle. You have to keep a track of your menstrual, cycle. Then you also have to keep a proper hygiene, which means that you have to change your pads frequently. You should not use dirty clothes for using the pads at night when you're sleeping. Just use a pad. Otherwise, if there is leaking, you'll be more embarrassed in the morning. Do not use washing products which contain lot of chemicals. So these are more or less some do's. And do nots means that do not consume too much of salt, do not consume too much of coffee, avoid having sex during this period, avoid having avoid keeping the tampons for more than 3 hours or more than, because it can lead to toxic shock syndrome. Avoid smoking during this period. So these are some do nots during this period.
Absolutely. Are there any lifestyle measures that one can adopt to ensure that periods are normal? As in, one does hear about, on one hand, the whole syndrome of obesity and the polycystic ovarian disease and all that, and then there's also the other syndrome of like where there is an absence of period because of like maybe not eating enough, or not, the BMI is low, kind of thing.
Yes, that's right. So nowadays we have seen a lot of girls coming with. They actually tell us, doctor, I have a polycystic ovarian disease. So basically, they always check whatever has in the internet or Google. But basically, it is a polycystic ovarian disease is a lifestyle and life changes disease. So, because of sedentary lifestyle, lot of stress, obesity, use of junk food, lack of exercise, all these, problems, they lead to polycystic ovarian disease. Lot of stress also leads to polycystic ovarian disease. Or absence of periods can also happen when you are doing a lot of workout, like if you're a swimmer and if you swim for 6 to 8 hours every day, or if you're a runner. So you can have absent periods for a couple of months. Similarly, if you are underweight, if you suffer from anorexia nervosa, these can also lead to absence of periods. So if somebody is anorexia nervosa, again, it is something serious to consider. She needs to be seen by a gynecologist. Again, she needs to be referred to a psychotherapist where she can be properly counseled, her parents can be counseled, and she can be managed. Both these conditions are totally correctable. When patients with polycystic ovarian disease come, they think we can just use a magic wand and just help them to lose weight or something. But it is something which they have to kind of take care of themselves.
Let us talk a little bit more about, the premenstrual syndrome. Now, this is, I mean, it is something which is now recognized as almost like a syndrome, to even sometimes a disorder itself. So, this is something which many women suffer. And also, it probably was not so well known in the previous generations, but right now everybody knows about PMS. But very few know how to manage it, or is there any way in which it can be controlled or it can be managed? So, please, let's discuss a bit about that.
See, as I told you, premenstrual syndrome normally occurs in late 20s and early 30s. And the woman has a lot of symptoms. And even if she's married, the husband kind of says, oh, are you PMSing right now? Because she has these symptoms of bloating or a lot of irritability. She's in a fighting mood, lack of sleep. And, so all these symptoms, lot of body aches and pains. So all these symptoms are known as premenstrual syndrome or premenstrual symptoms. What they say is, because of the hormonal changes, if you consume too much of salt, it causes water retention, and that is one of the basic cause of premenstrual symptoms, which leads to retention and mood changes, irritability, etc., etc. Now, how to manage premenstrual symptoms is mainly it is said that if you reduce your salt intake, there is a lot of problems are going to be solved out. But however, there are medical medications, like if you use something like a diuretic known as spironolactone, if you give them, that causes reduction in premenstrual symptom. Tell them to give them low dose combined oral contraceptive pills, that can also help them to reduce their premenstrual symptoms. Then we can also tell them to alter their diet and lifestyle, which means that they should take adequate rest. They should consume healthy diet in form of vegetables and fruits, avoid junk food. So all these measures, they are going to help them to reduce that. Then there are certain multivitamins and non-USFDA drugs like pyridoxine and folic acid, calcium, magnesium, but they're not completely proven. Similarly, evening oil of primrose, that also helps, but we really don't know because there's no proper randomized controlled trial, but it can help. They don't do any harm.
The other important problem which many women face, which kind of affects their ability to, they affects their daily life really, is this pain which happens during periods. So while some people just breeze through and even exercise or go about everything normally when they have their periods, but some of them are so incapacitated that they have to be lying down or using a hot water bottle or taking medication. So why is this different for different people? And is it always that if you have painful periods, does it mean that there is something wrong?
See, in adolescent, yes, because there is no reason. Probably there is. Different people might have different, pain level or threshold, but mainly because it is because of the amount of inflammatory substances released in your system. So maybe if some people have more inflammatory chemicals released in the system, they can experience more pain. Similarly, if there is a family background, that if the sister or mother had severe dysmenorrhea, these people can um, experience more pain. But the other cause of pain during periods is secondary dysmenorrhea. So these kind of ladies, they might be having pelvic inflammatory disease, endometriosis, adenomyosis, which gives them a lot of pain during periods or just before the onset of periods. And this takes them off work, or they have to stay at home, take rest, take a lot of medications. And even if that's not helping, then at last they come to the gynecologist. Actually, they should have come earlier so that they could have been managed properly.
Do these menstrual irregularities and whether it is excessive bleeding or any other disorders, do they affect the future chances of pregnancy in a woman?
Yeah, it can affect. Like if the periods are irregular, if the lady is suffering from polycystic ovarian disease, if the lady is suffering from delayed periods, she might have difficulty in getting pregnant because her ovulation is uncertain, or she might not ovulate at all. Similarly, if a lady is very anemic because of heavy menstrual bleeding, she might also face difficulty in getting pregnant.
And also, I think with endometriosis, also there is a chance.
Endometriosis also, she has difficulty in getting pregnant because the tubal, anatomy might be distorted, or there are a lot of adhesions. So even when the egg is released, it cannot reach the tube, and fertilization might be affected.
Are there any menstrual symptoms which may indicate an underlying cancer?
There are menstrual symptoms like intermenstrual bleeding, excessive vaginal discharge. They basically, or low backache or pain, suprapubic pain, they are more indicative of, uh, cancer of the neck of the womb. But it is said that ladies whose postmenopausal bleeding, as I told you, 25% of the ladies might be having endometrial cancer. So early onset polycystic ovarian disease, the patient needs to be counseled about the long-term consequences of polycystic ovarian disease, like gestational diabetes or hypertension or endometrial cancer in future. so that they are aware and they will change uh, their diet and lifestyle accordingly. Because if we kind of scare them a little bit, that's what we do.
Next, we can talk about the next phase, which is the menopause and the perimenopause. So, this perimenopausal period also, there is quite a lot of, one hears of women who have go through a very rough time, or for some, the periods just stop eventually. So, there are hardly any symptoms. So, what is the perimenopause, and what kind of do the periods become irregular, or can they become excessive at that
Yeah,
point?
because of hormonal changes and declining hormones or some other pathologies, they can experience heavy periods or prolonged periods. Their cycles sometimes maybe 2 to 3 months, but whenever they experience the cycle, they can bleed from 15 to 20 to 25 days, and which is kind of very annoying. But at the same time, it can suddenly cause them to be anemic and they become weak, faint, dizzy, etc., etc. The other perimenopausal change which we see is these patients again have a lot of hot flushes. So that can also lead to, a lot of psychological disorders. They also have difficulty in sleeping. They suffer from emptiness syndrome, etc., etc. But main bleeding disorders are excessive uterine bleeding, and the periods get irregular. Though they are not scanty, but they are heavy. But they come every 1 to 2 months, 1.5 to 2 months.
We did touch briefly upon the menstrual hygiene and about the changing of the pads, but often nowadays women also have these different types of products that they use. Like earlier, people used to use cloths, but now cloths have come back among certain groups of people because they think it's more eco-friendly. Then we have the pads, and then we have tampons, and then we also have the menstrual cup. So, what are the advantages and what is recommended for different age groups, or how does a woman make a choice?
See, I would suggest that sanitary pads are best for the adolescent girls because their hymen is intact and they are more comfortable with it. When a girl is sexually active or a woman who is married, for them, menstrual cup or tampon is important. Like they have a choice between menstrual cup or tampon. The only thing which they have to be careful with the tampon is they don't have to insert it for too long because, as I told you, I've really seen 2 3 educated professors coming with toxic shock syndrome because they forgot to remove the tampon. So that is, but nowadays menstrual cups are getting very popular, especially in the married ladies because it's easy to kind of insert and they have to less frequently change the pads or not worry about the pads at all. And it is also reusable, so it is also cost effective.
So, I think we have covered almost the entire gamut of menstrual disorders for the various age groups. So, thank you so much, Dr. Usha Bora, for this wonderful discussion, which I'm sure our viewers found very useful. And dear viewers, I hope you have enjoyed this session. And you can reach out to us for any further queries, and we are present in all the social media channels, and we are always ready to respond to any assistance that you may need. Remember, it is natural for women to menstruate. It is never to be considered as something to be hidden or to feel ashamed about. So, it is also very essential to seek help on any aspect of your period that seems uncomfortable or abnormal. You don't have to go through it. Take care and see you soon again. Thank you and namaste.